Good morning, everyone. I'm Dr. Radlisha Sneed, and I'm here representing the Master of Public Health program here at Michigan State University. I co-chair the Workforce Development Committee, and we are so happy that so many of you are here today to talk a little bit about public health communications. Before we get started with the workshop for today, I want to introduce you to the other folks who are here with us today to help lead the session. First, Mark Valachek. Mark, if you want to wave your hand. He co-chairs the Workforce Development Committee with me. And then we also have Bob Wall, who's on faculty here at Michigan State and also a part of our Workforce Development Committee. And then our two main leaders for the workshop today, Kayla Habermel and Sarah Clark. So thank you all so much for coming. I'm going to turn things over to Kayla and to Sarah to get us started.
Great. Thank you so much, Dr. Sneed, and thank you so much to everyone for being here today. We're really excited to chat through some communication strategies that you all will be able to use in your work. Before we get started, we're just going to do quick introductions and a couple housekeeping notes. So as Dr. Sneed said, my name's Kayla Habermel. I'm a science communication strategist, which is a really fancy way of saying that I get to take all the really cool things that scientists do in the labs and make that understanding and accessible to everyone else. I'm also a Master of Public Health student at Michigan State. I actually used to be a reporter in Flint. So lots of connections to the public health space there. A lot of my experience comes from taking these really complex topics and making them understandable for everyone else in a variety of ways, from news releases to emails, in-person, videos, remarks. So if it exists and it's communication, I've probably done it. So please feel free to drop questions in the chat as we go through. We'll be keeping an eye on it and we'll address those. We also really appreciate everyone who submitted questions in advance. We went through them all and tried to incorporate as many as possible into today's presentation. For those that we can't get to, we do have some resource sheets and a long list of free resources that we'll provide to you all after. So even if we can't get into it in depth, we won't leave you hanging. We'll have some other things for you at the end of this. So with that, I will turn it over to Sarah for her introduction.
Hello, everybody. My name is Sarah. I'm currently a PhD student in the clinical psychology program at Wayne State. And most of my clinical work and research largely focuses on developing and implementing community level health interventions. So one of the populations that I primarily work with are individuals that are experiencing homelessness. And the favorite thing about what I do is being able to build something not only for the community, but with the community. So prior to coming back to grad school, I worked for a little while in a market research firm specializing in health equity research and did a lot of coordination for participant recruitment. Likewise, I'm really excited to be here with all of you guys today and share some tips and maybe some lessons learned along the way for working effectively with community members.
Awesome. Thank you, Sarah. So this is just a very short overview of what we're going to be talking about today. So we're going to set the stage with some communication basics. From there, we're going to discuss some strategies for success, and that's going to include how to develop messages, identify your audiences, simplify complex or technical information, and more. We also, at the end, are going to have a little bit of a breakout exercise where we're going to practice some of these strategies that we discuss. So again, if you have questions during the presentation, please feel free to drop those in the chat, and we'll also come back to that question we asked you at the beginning here in a few minutes. All right, so let's set the stage here. So what is communication? This seems like a simple question, and most people, when we talk about communication, think about something like this model up here, right? You have someone who's a sender. So in this case, I'm the sender. I'm talking to you all right now, who is saying the thing or conveying a message to a recipient, and the recipient usually your audience. And this is true on a really basic level, but it kind of loses the nuance of what communication actually is. And what communication actually is more like this. You'll notice that there is this one-way communication, right? Your sender to the recipient. But then there's this feedback loop. And that's because communication isn't just one way, right? It's two-way or it's multi-way. It's really a conversation between people. It's more than just telling people what we want them to know. It's identifying what our audience wants to know and tailoring our message to achieve a shared understanding. And communication includes the ways that people receive, process, and internalize information and how they respond to it. So it's much more than just us saying a thing and people remembering it and acting upon it. It's important to remember too that communication doesn't happen in a vacuum. There are all these other things that influence how we develop a message and then how the people that we're speaking to or sending the message to actually receive and understand it. So when you're the sender and you're developing your message, you're doing that within your own context. You have all of your own social determinants that you're exposed to, all the things that you experience during your normal day-to-day life. You have your beliefs, your culture, religion, age, political affiliation, whatever it may be, right? And those things shape our worldview and they also shape how we communicate. The same can be said for the recipients of our messages. Once we send a message, the recipient takes that, they think about it, they interpret it, they kind of store it away in their brain, and then they decide whether they're going to act on it. And they're doing all of that through their own context. So, to effectively communicate with folks, we need to account for these differences, and that means knowing your audience. One of the tricks to ensuring that the message that you intend to send is interpreted in the way that you intend it is really knowing the people that you're speaking to. Um, at the end of the day, we want to make sure that our message kind of maintains its fidelity as it goes from us to the recipient. So we're going to talk about how we get there. So here was our question that we had at the beginning. You all had amazing answers, and they were all right. So that's the easiest quiz ever, right? Everyone's right. Everyone gets an A. But why in public health do we really need to rely on communication? And that's in part because of these reasons and the ones that you shared in the chat, right? Communication is really the bedrock of public health. It's the bedrock of everything. It's what we're doing right now. And it's way more than just the words we say and the meaning of those words. It's how we communicate with our tone of voice, our body language, the words that we choose to use, who is actually the messenger who's saying the things, and then the meaning of the words beyond their actual dictionary meaning, right? There are connotations to the words that we choose to use to explain things, and that reflects our understanding, our expertise, and our opinions on a topic. Communication is also the way that we work with communities to identify needs and address them. It's the way that we advocate for sound public health policy, and it's the way that we build long-term sustainable and equitable relationships. It has special importance because people use information that we convey to make decisions that really deeply affect their lives, the lives of their families, and their communities. And this is really borne out, especially in crisis situations where clear communication can, not to be dramatic, but can kind of be life and death, right? So people need information to be accurate, timely, and actionable. And the way we get that to them is good communication. I also included inform and inspire on here. Both are important. Giving people information isn't always sufficient to get them to do something, right? Sometimes we need to inspire that action. We need to figure out the barriers to that action and help people overcome that. And that's all part of communication. And this last point that's really important is communication impacts equity. There's a lot of discussion in the health communication space right now that talks about communication and health literacy as potential other, whether they should be considered social determinants of health, because people's access to information, governs their ability to make decisions. If someone can't get the information about something, then they can't really make an informed decision on it necessarily. So these are some of the reasons that we're here today talking about this.
And just to feed off of that, one little like real life example of what Kayla was just talking about would be the rise of telehealth practices in response to the COVID-19 outbreak. So a lot of people who are lower income or may not have access to smartphones or Wi-Fi at all times, that left them with no choice but to go without healthcare or without receiving some of that updated critical health information. So this is something that was especially true for a lot of people that I was working with within like homeless shelters and things like that, as shelters don't typically provide Wi-Fi.
Mhm.
Okay, with that in mind, let's talk a little bit about community engagement. So these definitions may look familiar, but we're sharing them to ensure that we're all starting from a common place of understanding. So community engagement is how we work with communities, and it includes the process of building equitable, meaningful relationships with communities to help address their health issues. Importantly, community engagement should not be external people coming in to community members and telling them this is what you should do, this is not what you should do, but rather as this approach can be kind of condescending and frankly doesn't usually land well or isn't really effective. Instead, community engagement should rely on shared collaboration with the community to help identify problems, explore solutions, and address barriers that are unique to that specific community that you're working with. For the purposes of this workshop, we really want to focus on determining the most effective means for communication. So this means that we need to meet people where they are, and that includes things like showing up and humbly listening, being ready to learn, fostering that respect, empathy, and humility to help us develop solutions in tandem with our community, right? Rather than for our community. So to reiterate, communication is how we do this community engagement piece, right? It's how we're connecting with individuals and communities. And it's how we're able to identify problems to develop those solutions. So that's kind of the first step to being able to do that bigger picture stuff. It's also how we're able to share news and information about our work, right? And our findings. And this allows us to have a much broader reach and in turn, a much larger impact. So if you're new to community engagement, I want you to begin to start to think about what kinds of things you can do to infuse good communication within those community engagement efforts.
So let's discuss, sorry. Sorry. Let's discuss a few strategies that you can use just to do that. So some of these will seem familiar, but first is to meet people where they are, right? So a critical part of community engagement and communication is meeting people where they are. If we want to reach people, we have to do it in a way that actually works for our audience. So this means understanding who our audience is and how they prefer to receive communication. So do they prefer to, talk in person? Do they prefer in writing? Or do they trust certain messengers versus others, and so on? Community engagement can help you find these answers and tailor your approach. So talk to people in the community, get to know them, connect with the community groups who are doing the work, and then be open, honest, and humble. One thing that we'll talk about later too is, not just going to people when you need something, but really talking to people early on, building those relationships over time, showing up to events, getting to know people, not just when you need something and not having it just be this transactional thing, right? Because then when the time comes for you to have to roll out, say, a program or a communication to a specific group, you already kind of have in mind how they like to communicate. You have some good connections in the community who can help you really collaboratively develop those communications. So what might this look like, right? So if you're trying to reach young people, let's say ages 18 to 25, about, let's just say, the dangers of like vaping, and you want to reach as many people as possible, you're not just trying to get people, say, in your specific community. You could look at doing TikTok or another digital approach, right? If you have the resources to do that, or something on YouTube, because for that audience, they're more likely to be on those platforms than, say, reading a newspaper or watching their local TV station. But if you're trying to reach older adults, so let's say folks maybe in their 80s or older, obviously TikTok is probably not going to be the place to do that. Older folks may prefer in-person communication or written communication. They may have people that they're more likely to trust information coming from. So maybe they're doctors, or a pastor or someone like that they know really well. So this is really what it means to meet people where they are. The more you know about your audience, the better equipped you'll be to do this. The second is to employ cultural humility, right? Like community members are the experts in their community. So in short, this is the idea that we don't know everything, but we're humble or willing to humbly listen and learn. Communication doesn't really work if you approach it with this rigid view of, what you want people to know, and not really listening on what they want to know or any barriers they may have in doing action based on that information. So instead, consider what your audience needs to know to act, the issues they may be facing, and then tailor that information and the delivery of that information so it works best for them. This is kind of a subtle but important distinction that shifts the focus from what we want and need as communicators to what will be most useful for the audience. And this is something I see in my work a lot with communications is, we have stuff that we want to say to people. And so we want to say it. We want them to be as excited about it as we are. But, people are busy. People have their own things going on, right? So we really need to understand what would be most helpful for them rather than focusing on what we want from them. Again, the way that we figure out what's most useful is we engage with people, we listen, and we learn. And the last kind of quick tip here is to drive communication from within, right? Like people in the community and groups are the experts in their communities and their groups. So for example, I am not going to walk into MSU's engineering department and start telling them how to design a car. That would be a disaster for everyone, right? In communication, the messenger is just as important as the message. And this is particularly important in groups who have been historically excluded or who have been under-resourced, right? People trust people they know more than a random person who just shows up one day, and often more than an organization, right? People communicate with people. We connect with other people. And so your message is always going to mean more coming from a trusted source than kind of a random person. So with that, let's get into these 3 pillars of communication. So in communications, there are a ton of resources that describe all these different frameworks that you can use to approach communication, especially for health. And they're useful, right? There are ones from the National Institutes of Health, the CDC, World Health Organization. We'll share links to those later. But in general, you can boil down all of that into these 3 pillars, right? So message, which is what you're actually saying, your audience, who you say it to, and then vehicle, which is how you say it, and the messengers that you choose to say it. So vehicles can be verbal, face-to-face, conversation. It can be a written thing like a news release or an email. It can be a video, all of that good stuff. And we'll talk about all of these pieces. So this next section is kind of a how-to section. We're going to talk about developing effective messages, knowing your audience, picking your right vehicles, simplifying complex content. We had a lot of questions about this, and we will give you some really good tips for that. Writing emails effectively, and then designing eye-catching visuals, especially if you're at an organization that maybe doesn't have, like a designer on staff or something. There are a lot of tools out there that can help you design really good visuals. And for the most part, there's a lot of free stuff out there that can help you too. So that helps with resources. All right, so jumping right into this, message is our first big thing. And it can be really challenging, especially when dealing with health and science and all of these kind of complex, nuanced topics. So messages, again, don't exist in a vacuum. How we develop them and send them and receive them are affected by our worldview and the worldview and experiences of our recipients. So as communicators, it's our job to kind of cut through all the noise and figure out kind of that main message that we want people to remember. So when we're looking at a really complex issue and we have to distill it down, one strategy that we can use to do that is to focus on our desired outcome, right? What do people need to know in order to make a decision? And so I often use these 2 questions when I'm working with folks trying to figure out, out of all this information that you have, what do we actually need to say to people? And that is to ask these 2 questions, right? If people only remember one thing, what do you want it to be? Or what problem are you trying to solve and why is it important? So this first question is really good if you have, findings or that you want to share or an action that you want people to take. The second is a little more helpful if you're at kind of the start of a project, right? Maybe you're starting a program, or you're going to try to recruit people to a study, or you want them to join a program, right? Or sharing information. These help you figure out kind of the so what, right? Like the why should people care? And they will help you determine your main takeaway. So along that line, in addition to these questions, you can employ what's called this 3-point strategy. So the first one is the main takeaway, right? Again, what is the one thing that people really need to remember? If they remember nothing else from what you say or what you do, what do you want it to be? Well, from there, you can use this 3-point strategy to bolster that, right? So your next 2 points in this are your supporting messages. They represent other important takeaways that you want people to have, and they help build on that main takeaway. So what else do people need to know to act? Why should they care? Is there a significant barrier to action? Do we have ways to overcome it? And these points will kind of serve as the scaffolding that you'll build the rest of your message around. They don't represent all the information. You don't need to use them verbatim necessarily, but it's going to give you this really common, consistent core of your message that you can then use to build other things. This is especially important in collaboration because it allows all of your partners to share the same message, which is important for trust building with the public. So the messengers and the exact wording of the messages might shift a little bit in the way that they're communicated, right? The vehicles that are used. But the important thing is that the main message, the main thrust of the message is being shared consistently. An example would be if you have a campaign that, say, involves the health department and maybe MSU and some community groups, right? Agreeing on these main messages early and doing that as kind of a collective act is important for consistency across groups. That means that you don't have all the partners kind of out in the public saying different things. Everyone's kind of aligned. This is where community engagement comes in with this. Again, working with community partners to really identify those messages that are going to resonate and help shape that messaging is really, really important. So a couple quick examples here. We just use the example of colorectal cancer. So this is the approach of, if you want people to remember one thing, what do you want it to be? So our main takeaway here for this is that colorectal cancers are becoming more common in young people, right? If people don't remember anything else, we want them to have this in mind. And the supporting messages to that are, there are steps that you can take to reduce risk and identify problems. And then we give them this action, right? You can learn more, you can do more here. The other way to do this is to look at that big problem you're trying to solve. And it's just a simple reframe. So colorectal cancer usually affects older people, but more young people are getting it. We don't really know why. This would be point 2, and we want to find ways to prevent it. So this would be point 3 here. So this is that 3-point strategy, really picking out those 3 main things you want people to remember. And again, it's not that you're not going to include any other information. These are just kind of the core of that message that you'll build everything else around. So what does this actually look like in real life? So this is an outtake from a document that the World Stroke Organization puts together every year. And they build this giant book for anyone that wants to promote stroke prevention on this day. And it includes messages and graphics and all the things that you need to help them with this, right? But you can see right here in the beginning, they have their main points, right? So their big takeaway, and you'll see this throughout this whole document, is that prevention is the most important thing. So you've got the main takeaway here, you've got this supporting message, right? You've got prevention, stroke is not uncommon, but there are things that we can do to take action. And that carries throughout their entire document, right? So the words you can see are different here. It's not phrased exactly the same, but the message is the same, right? You've got prevention, it's not uncommon, and most strokes are preventable, right? And so if you were to read through this document, and it's very long, but you would see this refrain being repeated the whole way. And again, the words may differ, but by keeping these messages consistent, that's reinforcing to people that main message, right? Prevention, stroke is not uncommon, but there are things that we can all do to prevent it. And it also then allows anyone who's promoting this to tailor that messaging to their audience, right? So the main message is consistent, but the way that we say it could differ a little bit. All right, so the next point to consider is how you actually structure these messages, right? When you're communicating to the public, how do you do that? And this is really important, I think, if you're coming from an academic background, because scientists and academics tend to write like this, right? You put all your background info first, and then you've got your details and the main takeaways tucked away at the bottom in your discussion. But the public doesn't really communicate that way or read that way. They actually do something a little bit more like this, right? Where the main takeaway is the most important thing. So it's always important to get that at the top, right? And then you can include why does it matter, and then the background supporting info. And the reason for doing this is pretty simple. Most people don't read to the end. Um, if you if you think about any articles that you read or anything, most of that important information is going to be at the top because again, most people just simply don't make it to the end. We're all busy. Even in academic writing, right? I feel like a lot of people read the abstract and then they skip to the discussion. So,
All right, so language matters. And this may seem like a really obvious statement, right? To say that the words that we use matter. But these words that we choose, they're the chaperones for our overall message. And they help us ensure fidelity from sender, us, to our recipients that we're trying to communicate with. So word choice here conveys more than a meaning of the word, right? It conveys our feelings, our knowledge, and also our biases on a subject. So for an example, if you're working with the LGBTQIA plus community and you are assuming a gender or not asking for someone's preferred pronouns, that can convey something, right? Either a bias, a lack of knowledge, or even a lack of respect. So the use of stigmatizing and paternalistic language can be incredibly damaging to the relationships that you're trying to build and maintain. So the use of such language, while it may be unintentional, we need to realize that certain words are hurtful and can be problematic. So this is another reason why it's critical to closely work with your community partners because they're the experts in this area and they're often going to make it clear how they identify certain verbiage for their circumstances, their experiences, and their overarching community. Okay. So one way that we can avoid kind of this misuse or insulting or offensive language is to employ destigmatizing and person-first language. So what do we really mean when we say person-first language, right? This means that we're choosing language that recognizes and prioritizes the agency of an individual rather than focusing maybe on a disease or a disability that they may have or a circumstance that they may currently be in. So again, destigmatizing language seeks to remove that shame and stigma from the words that we use, which can be really important because shame and stigma imply judgment, which in turn isn't super great for building relationships, right? So there are many resources available to foster this inclusive kind of language, including a guide from the NIH, and that'll be part of the resources that we provide to you guys at the end as well. But it's important that we use close community collaboration for the best way to ensure that proper word choice, right? So people in communities may have differing opinions or considerations, and it's important to be respectful of what those might be. So an example from my work, I know we have some examples here on the screen, but when I am speaking about homelessness, the politically correct term would be unhoused, right? That's what you're going to see in academic writing and papers. But me as a clinician, I prefer to say something like an individual experiencing homelessness. Because for me, this is an experience that somebody is having rather than a character trait or a characteristic of them. So again, we have to be mindful of the context that we're using this verbiage, right? If I'm writing up an article, I likely will be using unhoused. If I'm talking about it to a client, it's also important that I'm mirroring how they talk about themselves and their experiences and picking up that verbiage of how they identify and how they like to be spoken about with their experiences and their conditions. So that's something to keep in mind as well.
yeah. And I'll just add on to Sarah's comments that one that I see a lot is referring to people, people with cancer, maybe Parkinson's, because that's the areas that I work in most often as a patient. And a lot of the feedback you'll hear from people is, well, I'm not a patient if I'm not at the doctor, right? Like I'm not a cancer patient. I'm a person and I just happen to have cancer. And I think that awareness is growing. But that's something you'll see quite a bit in advocacy groups too, especially related to disease, right? Is that it's not people aren't cancer patients. They're a person, they just happen to have this disease. So saying, person with X is often preferred, and it gives them a little bit of their agency back too. Um, One thing also to know here too is a key tenet of communication is shared understanding. And so this is just as important for individual words as it is for the full message. So there are certain words that may have different meanings or different connotations to different people. Our social, cultural, religious context can all shift how words are interpreted. And some of the words may be surprising, right? Like they can be really common words that people just have different understandings of. So one that I see a lot is, the use of the word safe. And it seems like, oh, we should all know what safe means, but safe really can mean different things to different people, right? So if you take the context of vaccines, for example, if you're a public health practitioner or a doctor, when we say vaccines are safe, what we really mean is we know that all medications and vaccines and any medical anything has a risk of side effects, right? But those risks may be limited to a small group of people, or the risk of the disease itself is much greater than this really, really minimal risk with something like a vaccine. And that the best way that people can protect themselves and others is getting vaccinated and limiting transmission. But we know this because this is an area that we work in. Maybe, we're a doctor that's gone to medical school, or, we just have more of this kind of in our heads. But if you're a person in the public who doesn't have all of that, and you're being constantly told, this is safe, everything's fine, but then maybe someone or you hear a story from someone else that they maybe had a reaction, you kind of have this thought of, oh, I was told something and it's not true, right? So, are there better ways that we can convey the fact that, yes, this thing is safe and there's, always a small chance of something, right? So, one way that you could do that is instead of saying, making something sound like everything is safe 100% of the time, you could say every element or every medication has an element of risk, right? But the risks of getting sick with COVID or the flu, I mean, pick whatever, really outweighs the minimal risks of getting vaccinated. And getting vaccinated is the best way to protect yourself, your family, and your community, right? And so what you've done there is still convey the overall meaning, but you've given people a little more transparency and a little more context for what we mean when we say safe. And so just considering the words that you're using and how people may interpret them, it can get you a long way and also kind of can help you head off issues that could arise. I just wanted to drop to this little note on statistics. So we received a few questions about how you talk about statistics in health communication. And they can be a really helpful tool for communicating the scope and importance of health information or the impact of a disease or in a program. But it's not really enough to just include numbers and things. We have to make them really meaningful. So statistics and numbers should really support your messages within the context rather than being the message themselves. You'll see at the bottom, there's this link, the bit.ly link. So the National Cancer Institute has this really amazing guide for how you can use statistics and health information in your communications. It's pretty long, but it's very thorough. It's really accessible. They go through everything. So this link will be included in the resources we share with you all after, but I would really recommend it if this is something you're interested in. But in general, here are a few kind of high level tips that you can use. The first is to focus on the bottom line. Much like defining your main message, consider the high level meaning of the statistic, right? The so what, like why should someone care about this? Why is it important? And make sure that that's conveyed in there so people have the context for what these numbers mean. The next one is to not overstate data. And this is where I think people have a little bit of a harder time, because if you're speaking in an academic sense, you have all this technical language and jargon that you can put around a statistic to make it really clear what it means. But when you're speaking to the public, you can't really do that because technical language can be a barrier. So try to think of ways to still convey the meaning without getting lost in the details or oversimplifying it. There's often this perception that simplifying things can lose loss of meaning. We're going to talk about ways to prevent that. But what this might mean is that you have to include some additional context that you maybe wouldn't have to if you were talking to someone else, maybe another public health person, right, who knows what all these technical terms mean. Be cautious about cause and effect. I think it's said a lot, correlation is not causation. The public is always a little more inclined to lean toward cause and effect, and not necessarily see the nuance. And that's, again, just because they don't necessarily have all of the background that we may have in that. So you have to kind of choose your words really carefully, to ensure that we're not implying a cause when it doesn't exist. And again, we know about the correlation, not causation. I don't know that that's as common in the public. So really reinforcing that, we don't know for sure it's a cause, making that clear. The next is to be transparent about uncertainty, right? And this can be really tough because we want to be seen as, a credible source. We want to be seen as a source that people can trust. And I think sometimes people worry that if we acknowledge uncertainty or acknowledge that we don't know something, that people won't trust that. And I think the opposite is actually true, right? Acknowledging that we don't have all the answers can be a way to build that trust, right? So be clear about what we know and what we don't, underscore if we don't know something and why. And you can say, we're working toward finding this answer. We just don't have it right now. And yeah, help people understand that, the way that health often works, or the way that science works, is we may know something today, we may know more tomorrow, but we may not know that thing right now. And I think that's okay to say. Provide context. We've kind of talked about this. You may need to put a little more explanation behind the numbers than you would if you're, sharing it with, someone in an academic context, but just giving people a little bit of background so that they know what these statistics mean. Avoid and explain technical terms. We'll get into this a bit too, but sometimes you can't avoid a technical term. But if you have to include it, explain it. An example would be, incidence rates, right? We talk about incidents. Try to frame it in terms of new cases, right? And then that gets you around having to explain what incidence is. And then use visuals as appropriate. I am a writer. I love words. People love visuals more than they love words. And it breaks my heart to admit it, but it is very true. So if you have the opportunity to use visuals, that can be really helpful. General best practice is to use one visual for each statistic. So try not to cram a ton of information into one graphic. Use really high contrast colors, make sure your labels are really clear, and just be really intentional about how the total effect of that visual is going to come across. All right, so we've talked a bit about message and language. The next thing is audience, and message and audience really go hand in hand. Knowing your audience is a huge part of tailoring your message to drive behavior. So when you're determining your audience, really consider a few things, right? Like, what is your goal? Is it prevention, health promotion? Is it crisis response? And then think about what groups or individuals you need to communicate with to help achieve that goal. For example, if your goal is implementing a statewide free school lunch policy, your audience may be lawmakers, their staff, or advocacy groups. If your goal is maybe a diabetes prevention program in a community, your audience would be community leaders, community health workers, and the community members themselves, right? So here are some framing questions to keep in mind when you're thinking about your audience. So the first is pretty obvious, like, who will be affected, right? Who are the people who need this information? Who are the people that we're trying to help? And again, really building in those community relationships and getting community input on this is really important. They may have, community partners will have insights that we just may not have. Think about who cares about the topic, right? So there's a difference between who will be affected and who cares. That may mean, you've got your group that's going to be affected, but maybe you have other community groups that are working in that area, or other folks in other health departments or the hospital, right? Who else is involved in this topic? And then think about other factors that will affect messaging, right? This is really getting to know your audience. People who are part of the group that you're trying to speak to are best placed to help you identify opportunities here and challenges, and they can help you figure out how to best reach specific people within this group, right? Maybe they have inroads that you don't, or they know that people really don't like to get things via email or whatever that may be, but really use these 3 questions to help distill down who that audience is and how they like to be communicated to.
All right, so now I'm going to share with you guys just a brief little example of a time that this was relevant for me and my work that I do within homeless shelters. So essentially, I was organizing an event, kind of a mental health field day of sorts at a shelter a few years ago. And there were a couple things that I needed to consider while I was going about this and how to most effectively plan and promote this event. So one of the first things was planning around like the time and the day of the event. So would I do it during the week or the weekend? And considering that a lot of people at the shelter are out working during the days and may not be available. So I wanted to be intentional about planning it when most people could engage with it and benefit from the event. And then after that, after I got some of those things nailed down, I learned some best ways to communicate with for like new events and information from already working at the shelter. So primarily we did a lot of flyers and things because people would see it on their way in and out. So I started to, our old reliable designing a flyer. So the first example that I did, the first flyer, it didn't have a ton of graphics on it, but a few, of course, for aesthetic purposes. But the core information that I was trying to communicate was primarily text. And while I was working with one of my clients, they had actually pulled me aside and shared with me that they couldn't actually read the flyer and they didn't know what it was communicating or what it said. This made me really take a step back and understand how I was presenting this information and who it was reaching effectively within the shelter and the communities that I was working within. This also provided me the opportunity to ask them if they'd help me redesign the flyers to make them more accessible. So we went through and we made some changes and we added visual cues for each main takeaway or pictures that kind of, communicated what we would be doing at this event and why we should be excited about it. And not only did this help me make my communication materials more effective and reach more people, but this really provided a moment of empowerment for the people that I was working with in this community, right? And even after this, anytime I would make something like this, there were a group of guys that I worked with that loved to review it and kind of give me feedback and be a part of that, or maybe even tell me where I should, put these flyers up so they're most effective. So it really helped them kind of take this ownership of this event that I was putting on and get people more excited about it, which was a win-win at the end of the day.
Awesome. Thank you, Sarah. All right. And then we have an example from Dr. Sneed.
Yes, so I do a lot of work focused on health interventions for older adults. And in many ways, working with older adults is a lot different than working with youth or working with middle-aged adults. One thing I've learned quite a bit from working with older adults is that the ways in which you communicate, it's preferred that they're much more personal methods of communication. So rather than sending emails and text messages to older adults that I want to engage as partners, it's worth it to make a phone call. It's worth it to meet in person. It's important to attend events where they already are in order to engage them. Also, another thing that we see that's really important is that oftentimes older adults may have transportation barriers. They may no longer drive, or they don't like to be out late at night. So it's important in a lot of my work to make sure if I'm working with older adults doing things in the community where they are, or making sure that we arrange transportation so that they're able to engage with us. Additionally, we try to have activities during the day when it's daylight and when older adults tend to feel comfortable. Something else that we also tend to do when working with older adults is to partner with faith-based organizations as well. We know that religious participation and church attendance is much higher among older adults than younger adults. And so a lot of the work that we do engages faith-based organizations who are considered to be trusted messengers in many communities of older adults.
So thank you, Dr. Sneed, for sharing that. So this next part actually builds on the examples that Sarah and Dr. Sneed just shared, which is how you deploy your message. And we call these vehicles, but it's really important to know your audience to, again, know how they like to receive information. So in general, you have written things, so that could be emails, articles, op-eds, flyers, all of those good things. Verbal, so in person, visual, flyers, graphics, TV, all of that, and then social. And you'll notice that there's a lot of overlap between these, right? So a video is verbal and visual. It can be put on social media. There's probably a script involved, so that could be written. But these are just kind of the broad categories. The other part of vehicle that's really important is who your messenger is. And so always considering who is best positioned to deliver the message to your audience, and who do people trust, right? Like, who is it going to mean the most coming from? So when we are figuring out the vehicle for how we want to convey our message, these questions can be really helpful in doing that. So which vehicle can help you best tell your story, right? So again, as I said earlier, I'm a writer. I love to write. Writing is often not the best way to convey information to folks, right? So as Dr. Sneed mentioned, older adults may prefer to receive information in person or through written communication, while younger adults may prefer shorter or more visual content, right? So figuring out how your audience likes to receive that info and then picking your vehicles based on that is really, really critical. Again, how do they prefer to receive that information? Which vehicles are most trusted by the community, right? So if it means more coming from, for example, a community group than a governmental group, maybe working with that community group is better than the other way around. You also need to consider barriers that your audience might face, right? So as Sarah mentioned, there are literacy issues to take into consideration. There are technological issues, right? So the digital divide is a huge problem and something that we need to keep in mind. So if you're doing something that involves access to the internet or social media or anything digital, right? Do people have the tools they need to be able to access that? Do they have Wi-Fi? Do they have a phone? Is it a smartphone? And then are you using a technology that they just may not have access to? There are also accessibility considerations, right? We'll talk about this a little bit, and if we have time at the end, we have some content too that addresses accessibility and ADA compliance specifically, but really thinking about people, like how they're going to be able to access and interpret that information. So if you're doing a video, you're going to want to make sure that you include captioning. And not just subtitles, but actual captioning so that people who use screen readers will be able to access that content. If you're doing something that's really visual, say you're doing a post on Instagram that has the picture, making sure that you include what we call alt text, which is a written description of the image. So again, folks who use screen readers will be able to access that information. Thinking about what resources are available. Resources are always a problem, right? We never have enough funding to do the things that we want. But really thinking about what resources are out there so that you can create effective content. We're going to give you a whole list of free resources at the end that you'll be able to leverage that'll help with that in designing visuals and that kind of thing. So hopefully that'll be helpful. Content development can be really expensive, right? If you have to have a graphic designer or, if you're fortunate enough to have a communications team at your organization, they'll be able to tell you it is really expensive to develop content, but there are ways you can do it without having all of that. And then talking again to your community partners. Do they have expertise in certain communication channels? Are there best practices that they use to reach folks? They can tell you what your audience prefers. So really keeping in close contact with them, and again, building that relationship over time so that you're not just coming to them when you need something or need to ask them a question. With that, just a quick note on social media. So we had a lot of questions about social. A deep dive on social is a little beyond the scope of today. We could spend an entire week probably of a workshop talking about social media stuff. And the trick would be that by the time we were done, the information would be out of date. Social media changes really, really quickly. In general, though, you can employ all the stuff that we're talking about today in social media communications, right? Good communication is good communication, regardless of the way that you do it. But I do want to say that while social can be a really powerful tool, there's this kind of perception that's existed for a long time that it's this free place that you can just throw stuff up and people will read it and they'll care and they'll do the thing that you want. And I'm sorry to be the bearer of bad news, but unfortunately that's not really true anymore. So social social media platforms are businesses, and truly targeting specific audiences now takes money. And they, sometimes they call it a boosted post or all of that. It's paid advertising is what it is. It can be really powerful, but again, it takes money. It takes really knowing your audience. And so if you want your message to find your audience and you're really trying to target a specific group using social media, you'll probably have to put some funds toward that. Now, that being said, it's still very much worthwhile to use social media and to post on social channels if your audience uses social. The way to do that is to design content that is really engaging, right? That kind of cuts through the noise. We call it stop the scroll, right? So if you think of someone who's on their phone and they're just scrolling through, you want to be that piece of content that makes them stop and go, oh, wow. Maybe that's through a cool image or a video or something like that. So you can do that without paid advertising, but it does take time to do that content. So I think we have to be really intentional about the social platforms that we use, our expectations of what we might get from them, and the amount of resources it will take. So if we have more time at the end, we can dive a bit more into it, but we also included some resources for you all to help create some really good content that'll help people stop that scroll. All right. So the next thing that we're going to tackle is plain language. So folks who maybe work in healthcare systems may be pretty familiar with this, but plain language is essentially language that is just clear and simple, and you're telling people what they need to know. In identifying your main takeaways is one way to do this. But the way that we talk about the takeaways is how we use plain language. So we got a ton of questions about this, so I'm hopeful that this will be helpful. So it's one approach to making information accessible. It's often used in medical practice, as I said, and a lot of public-facing communication from federal agencies. There's actually a federal law that mandates plain language use. So CDC and the National Institutes of Health have a lot of great resources for this. There's a link to NIH's plain language guide there. It's also in the resources we'll provide to you. But in general, here are a few strategies that you can use to use plain language. So with any communication, you start with who's your audience, what's your purpose, what's your takeaway. A good way to see what works well is to read materials that already resonate with this audience. And then when you're developing your own communications, you can start with these principles. So the first is to be direct, right? Put your main message first, focus on what people need to know. Don't bury the important information, right? If you remember the triangles that we looked earlier, you put those takeaways right at the top. The next is to use short sentences. So in general, we say about 20 words or less. This also helps prevent us from cramming too many ideas into one sentence. Really, you want one sentence to address one idea. And again, the next is to use first person language. So not just person first, like we talked about, but actual first person. So those are I, you, and we statements. Sometimes this isn't appropriate, but in general, when you can, using first person language is always more friendly and accessible. And it's also more interesting to people, right? It feels like you're talking to them. So an example of this would be call us if you have questions. The alternative to that, which is not using this first person language, is participants can call the team with questions. And you can see the differences here, right? This is longer. This isn't really direct. You kind of have to talk around what you want people to do. And it feels kind of cold, right? Right? Like, oh, participants can call. Like, okay, great, right? No, you can call us if you have questions. Is much more friendly and much more likely to get engagement with folks. The next trick is to use positive framing. Um, and this doesn't mean that everything is sunshine and rainbows and that we don't deliver bad news. Positive framing instead means that you tell people what they should do versus what they shouldn't do. It's much more straightforward and proactive, whereas negative framing can require more words and it can be a little bit more confusing because it requires more words to say. So you can see in the example here, wear sunscreen and hat to prevent a sunburn. So this is the positive framing. We are telling people you can do this thing. This is negative framing. So don't forget to wear, right? So we're not telling people to wear sunscreen. We're telling them to not forget to do that, right? So if you think about the way that people intake information, they end up focusing on this bit rather than this bit, whereas this is more important. Another example would be of positive framing is avoid swimming today due to dangerous currents versus to avoid dangerous currents, people shouldn't swim today. And you can see that that first one's a little stronger. The next one is to use common words, right? And this is pretty self-explanatory. Heart attack is much more accessible than myocardial infarction. And it comes down to jargon and technical language, right? So when we can avoid it, we want to avoid technical language. Sometimes we can't, but when we can't, we should explain it. The next trick is to remove filler words from our writing. And I find that people often use these because it mimics the way that we talk. So when we say very or actually or really when we're talking, it can add emphasis, but in writing, what it ends up doing is just kind of muddying what you're trying to say. So trim those out, it'll tighten your phrasing. For example, instead of saying like sunburns really increase the risk of skin cancer, you can just say that sunburns increase the risk of skin cancer, right? You just tighten it up a little bit and it gets your meaning across. Using active voice, this is kind of a nerdy grammar thing, but it's really effective. So active voice means that the subject of the sentence is doing the action. Whereas you'll hear passive voice sometimes, and that's when the action is being, excuse me, the action is being done to the subject, right? So in this one, the health department will host a vaccination clinic. The health department is doing this action. Whereas this is a little bit muddier, right? A vaccination clinic will be hosted. You'll see this a lot in academic writing. There's thankfully a move to this more kind of active style of writing, but in academic writing, you'll see this kind of phrasing a lot. In public communication, it has an additional downside, which is that it sounds like you could be trying to dodge something or be evasive, right? Instead of just saying the thing, it sounds like you're trying to talk around it. So anytime that you can use active voice, highly recommend it. It'll make your writing and your communication much tighter. And it also helps with trust building. Getting a second opinion or a third or a fourth, asking someone else to read your writing, look at your messages can be a game changer. And I think the really important thing here is asking someone who's maybe not in your field or isn't doing the same thing as you, right? So for me, I'm a science writer. I work with some folks on my team who, know a bit about science because we work at a research institute, but they don't have the same background that I do. So I'll often ask them to read something and they'll tell me, I don't know what this means. This doesn't make any sense to me. And then I can go back and fix it, right? Because ultimately, it doesn't really matter that I know what I'm saying. I'm saying it. Other people need to know. And the next is to just be mindful of tone. So just making sure that your content doesn't feel condescending. Plain language is meant to make things accessible, right? We want to bring people along with us. It's not, and I hate this phrase, but we often hear, dumbing things down. That's not what this is. We should strive to make things accessible, to make things open to as many people as possible and recognize that we all have different experiences and different expertise, and making things accessible to other people should really be the goal. So continuing to build on this, this idea of simplification, we've talked about a lot of these things, right? When you're simplifying complex content, you've got shorter sentences, less jargon, it's more straightforward. But then there's this other layer that you can add on to things, right? And that's, I'm calling it accessibility, but basically it's taking simplified content and adding some additional things that really make it resonate. And so the trick here is this simplification is often really good for crisis communications, when you need to get information out quickly, when you need something really simple and ready to go. Accessibility is simplified plus some of these other things. If you're doing more campaign style communication, right? Say you're rolling out a program, or you're trying to build support for something. It helps tap into some of the ways that humans connect to communication instead of just telling people things, right? So that's using words that resonate, varying your sentence length. So if you remember, we talked about using short sentences. That can feel a little choppy sometimes. And that's okay if you're trying to get the information out quickly. But if you have time to be able to add in a little variation, that can help people with actually the way that they're reading things. Storytelling is another great tool that you can use. People connect to stories. People love stories. And that can help get that information across. We also can leverage what's called gist. So people don't remember the fine details of facts. They remember the big takeaway, right? And that's where those main messages come in. So really focusing your communication on supporting people remembering that main takeaway. And then there's all of this theoretical stuff. We won't get deep into this today, but just knowing that there are other things that you can do to add on to this simple language. So let's take a peek at an example here. So you can read this if you want. It's a very technical description of what cancer is. And so it describes what makes cancer cancer. And it's great if you're a scientist, but if you're someone in the general public, it doesn't really do much for you, right? It doesn't really say much. So how might we tailor this to a public audience, right? Maybe these are folks who their last science class was junior high or high school. So here's an example. You'll see that it uses short sentences. It breaks paragraphs. These are very short paragraphs, right? 3 sentences at most. It breaks things up, and that's because it allows people to scan. So instead of throwing a big block of text at people, you give them this really scannable thing. It starts out with this explaining, kind of the idea of a cell, right? We shouldn't assume that people know what cells are. And then it goes into what cancer does. And, is cancer technically cells becoming sick? It's not entirely 100% accurate, but it gets the meaning across, and that's important. Again, if you read this, it talks about all these things that make cancer cancer. Really, the important part of it is that cancer has a lot of ways that it survives, and we can find ways and target that to help treat it. So we talked a bit about this with technical terms. We can't always avoid them. If you use a technical term, if you can define it, that's great. Here's an example with inflammation. It's one that I see a lot in my work because it's involved in a lot of disease things. And a lot of people don't know that inflammation actually isn't always a bad thing, right? If we didn't have inflammation, our bodies would not be able to heal and fight off infection. So being able to explain it in a way that's meaningful is really important. So in this example here, we establish kind of that it's a normal reaction, but that it can be problematic, right? And people don't need to know the fine details of it all. This is really what they need to know, is this takeaway. So let's discuss some additional tips and tricks for making complex content more accessible. One really powerful strategy is comparison. And analogy, metaphor, and simile are all variations on a theme of comparison, right? The differences in them is mainly a grammatical sentence structure thing, so I wouldn't worry too much about that. But the big takeaway here is you can use comparison to explain something more complex, right? So if you're in this example, we're using stroke, right? So instead of saying, that stroke is caused by blood clots that, close off the blood vessels in the brain and going into all that detail, you can use this kind of visual example to help people understand what's happening. So here we're using the metaphor of a clogged pipe. Analogy, you generally have a little more information, right? Metaphor and simile are a bit shorter. But really, the takeaway here is using a comparison to help someone visualize a more complex topic. These can be a little tricky to figure out, but if you can talk to someone in the community, talk to someone who is an expert in the area, they can kind of help you game out what is an appropriate metaphor. One thing I will suggest caution with, and you're hearing more, especially in the cancer space, is just caution with using metaphors that use violence, so war or battle. So someone's battling cancer, someone beat cancer, someone lost their battle with cancer. I'm kind of increasingly hearing that people are less comfortable with that because it can inject violence and shame into our language. So going back to what Sarah and Dr. Sneed said earlier, really talking to folks and seeing what they may be comfortable with, thinking about the ways in which that language could be interpreted. Some people are more comfortable referring to cancer as a journey. Some folks don't like that, right? Because it's not really a journey that anyone wants to take. So really talking to your audience and figuring out what they're comfortable with is really important. Some additional tips here, tell a story if it's appropriate. People have been telling stories as long as there have been people, right? It's a main way that we communicate and convey meaning and information. There's a lot of research that tells us that people retain information better when it's attached to a story or something with emotion than just facts. So if it's appropriate for the circumstance, find a story that really conveys that meaning and exemplifies your message. Here, again, working with community partners is really important. One, to make sure using a story is appropriate. Two, to make sure that the story that's being told works. And then also considering potential ramifications for the folks who are sharing their stories, right? Especially if it's a stigmatized topic, you want to make sure that the person who's sharing their story knows that they're going to be out in the public saying these things, right? So we always want to consider potential harm to our story subjects, and either, if it could be really bad, maybe we don't use a story, or we do things to mitigate that, right? It's a privilege to be able to tell someone else's story, so we really need to be the caretakers of protecting those folks when they allow us to do that. Another tool can be using emotion, much like story. The big caveat here is I would not do this in crisis situations or fraught situations. Always be cautious. Again, talk to your community partners. But if you're, sharing information kind of about a new program or a campaign, maybe you can use emotion to help bring people into that. One example that worked really well is this. This is a really blurry screenshot, so I apologize. The video wouldn't embed, but the Real Cost campaign, which is a campaign that is aimed at preventing youth from smoking or vaping, has this whole ad campaign where they talk about kind of the heavy metals and the chemicals in cigarettes and vapes as being kind of this like scary monster, right? So what they're doing here is leveraging fear. And it works really well in the context of this campaign. What I will say again is that the context is really important. Again, crisis communications, I wouldn't put emotion into it. You just want to be much more factual. But if you're trying to tell a story, this could be effective. And again, it's not that you're fear mongering or trying to terrify people. They did this in kind of a smart way. They made it into this like kind of mythical creature, right? And then the last tool is to ask a question, right? You can ask rhetorical questions to folks as a way to move your communications along. And that helps get them thinking about what their response might be in a certain situation. It kind of engages their brain in a different way. So this is a really helpful device in your communication.
Okay. And this is going to reiterate a little bit of what Kayla already shared, but some of the questions that we had come in before this, we're really focusing in on what's one best practice that I should include in all of my communications. So we really just want to encourage you to continue to lean into the humility of asking somebody else to give some feedback on your work, right? This is one of the most valuable things that you can do. Because as a lot of us know, writing and public speaking and developing content can be really hard work. And it's really helpful to have somebody like a buddy, a trusted friend, a colleague, or even at best, a community partner who can review some of the things that you've put together and give some of that more clear feedback. I know, especially for all of us, if we've written something or developed something, we've probably read it hundreds of times, right? Over and over again. And it kind of gets to the point where we're not able to give as much of that constructive criticism to ourselves. So it can be really helpful to give it to somebody else. And again, usually somebody outside of your field to see if it's really landing with those different people that just have different experiences and different backgrounds. So again, we definitely know that receiving feedback and asking for edits can be uncomfortable, but it's also critically important to developing good materials and good communications. So this can help identify areas of miscommunication, flag any problematic language that we've kind of been talking about, and ensure that you're not missing any of that key information and that it makes sense to the people you're sharing it with. So it really helps if you can take a moment to see your work through somebody else's eyes. Okay, we've talked a lot about how to communicate, but that also includes close collaboration with our community partners. So we want to talk about how do we even begin to do that, right? How do we initiate these critical relationships? So when possible, it's helpful to meet someone in person rather than sending that cold email, even though that might be more convenient. So this reflects a commitment to actually knowing the people that we're trying to work with and avoids that over-reliance of email, which is often, honestly, not the preferred method of communication for a lot of different people. So this could look like attending different community events. This could look like, really being intentional about talking to people at those events and getting to know them from a place where you're not first expecting something from them, right? So kind of laying that foundational work rather than just showing up and immediately asking them for something, even if it is with good intention and you think it'll have a big return for them. We really want to build that relationship first rather than being transactional, how we've been talking about. So we can't only do that community engagement when we need something from people, right? That's not how we foster long-term respect or equitable relationships. So again, when you're thinking about hosting events or planning meetings with those community partners, you really want to consider the different kinds of barriers there might be for attendance and also be willing to make some accommodations. So this might be meeting in the evenings after work hours, planning out transportation, especially public transportation, if that's something that would be helpful. Maybe it even means, getting bus passes for those community members so they're able to make the meetings, or having childcare on site, or serving a meal because it's around dinner time right after everybody got off from work. So these are all things that can help support and foster these relationships, but also help our community members really feel like they're part of something special and that it's a privilege to do these things with us. So these are just some considerations you can put into play when you're building rapport.
Yeah, and that's really, really important, especially as Sarah mentioned, the email question. So a lot of the questions we get are actually about emails and when to do it versus when not. Folks in academia often rely on email, but a lot of people don't, and maybe they don't ever check their email. So it may not be the best way to communicate with folks. So again, knowing your audience, knowing if you've met them before, what is the purpose of the email? Is it time sensitive? What are the technological limitations? Like these are all things to consider. And when you're deciding whether an email is most important, or sorry, not most, the best way to communicate or not. So in general, if email is the best way, or it's the preferred way for folks to communicate, really formatting is your best friend here. People receive a ton of emails. If you format it so it's scannable, so again, really short paragraphs, short sentences, put your most important thing at the top, that's going to save everyone a ton of time. The people you're emailing will be so, so grateful. Focus on the action. If you need something, make that clear. So that could be your subject line. Subject lines are so important, right? It tells people if it's urgent, if action is needed. I often will say, for review, and then say what the thing is, or, action requested, or something like that, just to give people an idea that there is something associated with that. And be brief, right? Only include the information needed for action, be short and to the point. This does not mean that, you can't be friendly and infuse warmth and kindness. Definitely you want to do that, especially in communication with community partners, right? We don't want to be cold and clinical. And just thinking about what actually needs to be in there versus kind of extraneous information that we might be able to peel out. So here's an example of a terrible email in a bad font. But you can see, some of the things that we just talked about, right? The subject line doesn't tell you much. The font, yes, Comic Sans. Please do not use Comic Sans. This is my ask to all of you. It's one big chunk of text. You've got this PS, which is what part of the ask, and it kind of sounds transactional, right? Like, we don't want people to participate because they have great ideas. We just want to make the work lighter. I feel like I've triggered so many people. I'm so sorry with this. But this is not great. So here are some of the issues. I'm sure you all can see all of these, right? It's unclear. It's really casual, probably inappropriately casual. You don't really know what this person's asking for. It's rough. So what might we do to fix this? We can reformat it. We can fix the font. You can see here, you've got a clear subject line. You set a little bit of context, right? The implication here is that, the sender has met these folks before, and we can assume that they were okay being addressed by their first names. This is something else to keep in mind, right? If you're emailing someone, you might be better off using their title for the first email if you don't know how they prefer to be addressed. And it's really clear what this person wants to do and what needs to be done. They also say, if you don't want to chat on email, call me, right? So you're giving that person something additional. So it's scannable, it's professional, you've got context, you're using clear language. You're still being friendly, right? It's not being cold and clinical, and you're focusing on mutual benefit, right? So that ask that was in the PS that felt kind of transactional, we've just rephrased it a bit to say, if there are other people that you want to bring in, this would be great. I'm also going to subject you to this horrible flyer. So we're going to talk about visuals really quick, but then I want to hop right to our breakout because we're getting right toward the end here. So rather than go through all of these things, there is a resource sheet that we're going to give you all that explains all of these and talks about how you can prevent creating flyers like this that are really hard to read. It's not super fun to look at, right? Like, this is what we want to avoid. You want to make sure things are kind of lined up, that your text is readable, it's accessible for people who may have low vision, and that people know what you're trying to say in visuals, right? So what we would move to, if we look at a new design for this, is something that has high contrast. It's much more readable. You can see that this is the big header of this. This is what we want people to know. And here are these tips and a way to learn more, right? So when you're designing visuals, really think about the information that you really need to include. Think about how the visual components can reinforce that message, and really focus on readability, especially if your audience has folks who may have low vision or other issues, right? That you want to make sure that they're able to access that. All right, so we're going to do breakouts, but just because we're running up on time, I think what we're going to do here is just run through this example really quick. And if folks want to volunteer their thoughts, if you want to drop that into the chat, that would be great. So we're going to walk through this high-level takeaway exercise here. So our prompt is kind of a crisis comms situation, right? If you're a communications officer at a health department, obviously we're borrowing from the horrible situation that the folks in Flint went through. But lead has been detected in the city water, right? We know lead is not safe. We know lead in water is bad. People need to immediately stop drinking the water. We don't know where it's coming from or how widespread the problem is, but the city is working to take action. So if you only have a limited time to develop your messages, think about what you need to say. If we work through those high level takeaways, right? Like, what is the main message that you want folks to do? And then what are those supporting messages? And if anyone has any thoughts, please feel free to drop those in the chat. We can give it a couple seconds and I'll walk through some examples that we came up with as what you could do for this.
And if anyone does want to talk out loud, just raise your hand. You can do that as an option too.
Yep. Sorry, I moved the slide back. There we go. All right, so please still feel free to raise your hand, but I'm just going to walk through the rest of the example. Again, please feel free to jump in. So if I was doing this, my main takeaway would be, we do not want people drinking the water, right? That is step number one. Do not drink the water. Obviously, we're not going to necessarily frame it that way when we say it to people, but that is our big takeaway. The big thing we want people to remember, if they remember nothing else, do not drink the water. So what supporting messages will they need as this is going on? So we need to consider what the audience is going to want to know. Well, they're going to want to know, how long have we been drinking water that there's problem. Yep. Stephanie in the chat, you want to relay that there's a concern, but also not to panic. Absolutely true, right? So that's something that you can build into your supporting messages, right? As well as an action that folks can take. So, we've detected this. There's no reason to panic. We're working to get more information. The city is setting up bottled water and filter distribution points. You can find those locations here, and maybe there's a website that you can send people to, considering also that maybe people can't access the internet, right? So where else can you put this information that they can get it? A couple other folks in the chat, it's important to use a lead eliminating filter that will reduce your risk. Absolutely, that's a great one. The water is unsafe, do not drink it. The city is working on bottled water, 100%. Absolutely. So those are all really great examples of supporting messages that you would add on to do not drink the water. So thank you all for sharing that. Ignore this part up here. We're not going to have time for this example, but these are just other examples of how these break down, right, for your takeaways. So this is the stroke example from earlier. And again, the colorectal cancer example, right? So trying to think about things as how you create this main takeaway and then things that support that. So we're going to close on resources. This is a very short version of the resource list that we have for you all. So this is the bit.ly link. You'll find all of the resources here. Again, this will be sent to you, so no worries about writing it down. We'll send this out to you. Canva, BioRender, Piktochart, and Freepik are all web-based platforms you can use for visual design. They're pretty easy to use. There's a lot of tutorials. They all have free versions too. So if you are, running into how to make great visuals, these are all great tools for you. CDC has an image library that you can use. It's great. I will say it is a public health related library. Some of the images can be a bit rough, so just that's a little warning for that. And some additional resources for toolkits. So these are all free toolkits and frameworks for different types of communication. We'll send this all out to you. But yeah, well, in our last couple minutes, do we want to, oops, sorry about that. We can jump to questions. If anyone wants to drop them in the chat or speak up, we can do that too. And I think we're going to post the slide deck and the resources as well. So if anyone wants to read through the slides, including the ones at the end that we didn't quite get to, we'll drop those in as well.
Yeah, feel free to drop questions in the chat. I'm also going to include a link to an evaluation of today's session. So if you'd like to complete that link, it's just a survey to tell us what you liked, what you didn't like, and what future topics you might be interested in for future sessions. We'll stick around for a few minutes for questions as well.
Oh, yes, Josh, Papyrus is definitely a font that all of us should set aside. I can agree. Thank you. So while we're waiting to see if questions come in, please feel free to add them. But I'm just going to skip through to, we talked a bit about this. We received some questions on accessibility. It's really important. I think the question was, how important is it? It's really, really important. So thankfully, there are a ton of resources out there for you all. This one is one that we provide in the doc. We talked a bit about all of these, but yes, definitely the more accessible you can make things, the more people we can get our messages to, right? Same thing with ESL folks. Oops. These are all some tips that you can use. A lot of it is just general good communication practice, right? Like slowing down your speaking. This is something I struggle with. Pausing, avoiding slang, right? That always is a chance for misunderstanding. Simplifying your sentence structure. You'll see a lot of these things are the same, right? Let's see here. Crisis comms. This is an entire thing of itself. We received a lot of questions about this. The CDC has a great manual and website for this. So it's called CIRC. The site is there. We'll send you the link, but it tackles everything. The big takeaway for this is the time to plan for a crisis is way before it happens. If the crisis happens and you're just starting to talk about it, you're a little bit behind, but you can plan ahead, and that's great. The last couple are on cultural humility. Again, here are some tips. We'll send these out. And then mis and disinformation. We had a lot of questions on that. So again, we'll send this all to you because this is something I think we'll all be tackling for a very long time, unfortunately. So yeah, I don't see any other questions in the chat. Just scanning really quick.
All right, so if there are no other questions, Kayla, if people have questions, is it okay for them to reach out to you directly?
Yeah, absolutely. I
Okay.
will, I can drop my email in the chat, and then right, there is my email. And again, we'll send those resources out, and we'll add the slide deck to that too. So that'll show up there in probably about an hour.
And then we'll also include the recording of the webinar today as well for you. All right, everyone, thank you so much for coming. I hope this was really helpful to you. Have a wonderful weekend. And please look out for an email from me with all of the content from today's session. Thanks so much, everyone. Bye-bye.
Thank you. Bye.